Hello, Dr. Palmer here. I am here talking about the North American Pharmacist Licensure Examination. So, this is what to expect when you're expecting to take the NAPLEX. And the NAPLEX is a very important milestone in the career development of a pharmacist. It is the licensure examination that allows individuals to become licensed practicing pharmacists. So, it is very important once you get your PharmD, you're able to pass this exam. So the NAPLEX, it is an exam that is required in the United States for individuals to pass. It's developed by what we call the National Association of Boards of Pharmacy, or NABP. NABP is also the space that holds your law exam results, that allows you to transfer your scores or move your scores to other states so you can be licensed in multiple states, and you report your continuing education credits into NABP. Now, the NAPLEX itself is a test that's designed to look at an individual's minimum competency to practice safely. So once you get your degree, once you have done the intern hours or the regulations for each specific state to then be approved to take the NAPLEX, the NAPLEX is there to ensure that there is a minimum competency to practice pharmacy safely. So we make sure that we are able to take good care of our patients in a fairly standardized way. So a little bit of background information about testing scores for professional licensure in healthcare. After the COVID pandemic, really after 2020, we've seen some changes in success for individuals taking a number of these types of exams, including the NAPLEX and the Law 1 MPJE. So we've seen a decline in those pass rates, especially 21 through 22. And more recently, we've seen a little bit of a fluctuation back up, which is wonderful. We are not the only group of individuals that have seen some decline in success for first-time test takers. The NCLEX for nursing also had seen its lowest pass rate in 2022, with less than 80% of all first-time test takers successfully passing the NCLEX. In medical school, individuals, as they progress into being a physician, take step tests. So the UCMLE Step 1 test pass rate, which is usually in the upper 90s, dropped 4% between 21 and 22, and an additional 1% from 22 to 23. So now they're in the low 90s. There's a lot of different reasons why we might see changes in these pass rates. We cannot deny that the education and the structure change from the COVID-19 pandemic is going to have some lasting repercussions for our incoming healthcare professionals. We see changes in the PCAT, which is a test requirement that has really fallen out of favor for colleges of pharmacy as part of their screening criteria, despite it previously being a pretty strong predictor of success on the NAPLEX. So we're really not seeing those types of test scores coming into pharmacy school anymore. They've also recently updated in the last several years the blueprint, so those domains and how they're testing, as well as the number of testable items for individuals who are taking the NAPLEX. So it's a longer exam. It's a more challenging exam in a lot of ways. Students are also faced with a huge product market when it comes to, books and apps and practice tests and resources to help prepare for the NAPLEX. And not all of those products are going to be as high quality as other products. And there's really not great scientific data that has been analyzed to determine the benefit or which one is the best for a student to use, how much they improve, and those types of things. So there's still some challenge in knowing which types of products, if any, an individual should utilize to be successful on the NAPLEX. So a little bit about the NAPLEX itself. This exam can take up to 6 hours. Potentially longer if you have an accommodation that gives you extra time. And this is a computerized exam that has 225 total questions. Prior to the administration of that exam blueprint, there is a standard setting that occurs where licensed pharmacists will take the exam to determine the accuracy and the space with which the line is kind of drawn between pass versus fail. The items, which are the test questions, are written by what's considered subject matter experts. However, the determination of whether someone is a subject matter expert or not through the NABP is not really well defined. So in general, you're going to be taking the entire day for this. Okay, so 6 hours and 40 minutes is my general recommendation for how long to sort of block off, but really just take the whole day. It's going to be exhausting because pieces of the exam also include the check-in. There's a pretty robust check-in, paperwork verification process, and you do have 2 optional 10-minute breaks. Now, I can't recommend enough taking those 10-minute breaks to decompress, to use the restroom, to stretch your legs, because it is a very intense experience to take the NAPLEX. In terms of the actual test items or questions, 200 of those 225 are considered into your score. So those are the testable items that have already been vetted and psychometrically evaluated for accuracy, reliability, and validity. 25 questions are what they call pretest questions. So essentially, they are trying to figure out if these are worth incorporating into the NAPLEX in future years. And people who have a degree in psychometry or psychometricians evaluate statistically the performance of those items to determine if they should be testable items in the future. A lot of the questions will be from a medical record or scenario-based format. So there will be cases that individuals will have to read and interpret that data to respond to related questions. There will be some standalone questions as well. And you have to answer those questions in the order that's presented. You cannot skip questions. You cannot go back to questions. There's no backwards navigation. So if you are uncertain of an answer, don't spend 20 minutes trying to figure it out, but you also cannot go back to it. All right. So making sure that you're aware to pace yourself as you go through this, because you have, less than 2 minutes per question. It's about 1.5 minutes-ish per question to answer. And some of them are going to be multi-step math problems that are going to take a little bit of time. So one reason that people are not successful in the NAPLEX is that they run out of time, despite it being a 6-hour exam. The types of questions that you may run into on the NAPLEX include standard multiple choice question, right? So you get 4 possible answers. You pick the best answer for that question. They also have multiple response questions, and this is everyone's favorite, select all that apply. Select all that applies are much more what we call discerning, in that it can really do a great job of separating people who have high performance versus low performance. So they're very robust and helpful psychometrically, but also can be really frustrating to take because you don't know how many are correct, right? So if you have 4 options, maybe 3 of them are correct, maybe 2 of them are correct. In addition to that, we also have what's called constructed response questions, and these are your fill in the blanks. And in general, most of the fill in the blanks are going to be a specifically rounded number. So you perform a calculation, whether it's for total parenteral nutrition or aliquots, all that wonderful stuff. And you would type in the numeric answer rounded to a specific decimal point that should be dictated by the question itself. Okay, so moving into the blueprint domains. So what exactly is being tested on the NAPLEX? We've talked about the how. What's the what, right? So there are a number of different areas that the NAPLEX will be testing on. Area 1, which is worth 18% of the exam, covers obtaining, interpreting, and assessing data for medical or patient information. So there are 4 kind of subgroups within this domain. So this is looking at screening tools, laboratory data, genomic information, diagnostic findings, treatment adherence, medication taking behavior, someone's chief complainer, what they're reporting of, their medication and medical history, as well as their family and social history, lifestyle factors, and socioeconomic factors. We also can potentially be tested on treatment adherence, medication taking behavior, their chief complaint from the practitioners, same kind of ideas, but from a different perspective. And also, same thing, same kind of ideas, right? Treatment adherence, medication taking, background, etc., from the medical records. So you're obtaining and assessing those pieces of information from a variety of different sources, right? And this is where a lot of the interprofessional experience can be really helpful, right? Because you might have to get information from the patient directly, or from the practitioner, or from an individual's electronic health record. The rest of the pieces here also look at signs or symptoms. So looking at having an understanding of the pathophysiology, the etiology of diseases and what those look like. So physiology and pathophysiology. Risk factors for maintenance of health and wellness, and then evidence-based literature. So understanding primary, secondary, tertiary references and resources, a little bit of statistical evaluation in there as well. So being able to look at literature. Area 2, which is about 14% of the exam, is drug-specific characteristics. So that includes the pharmacology, the class of drugs, the mechanism of action. Okay, so how the drugs work and where they fit into the other groupings of drugs. We also can be tested on the availability. Are they prescription? Are they over the counter? Brand versus generic? Understanding the names and those differences, especially for the most common medications. Physical descriptions, how they're supplied. Do they come in tablets? Do they come in injections, etc.? And then safety stuff, right? So boxed warnings and risk evaluation and mitigation strategy programs. So what is the boxed warning for antidepressants? Or what is the requirements for a REMS program for a chemotherapeutic agent? And then pregnancy or lactation. So that's part of some of our special populations. What is the risk in pregnancy for exposure to certain medications? Area 3, which is about 35% of the exam, is developing and managing treatment plans. So there are a number of different steps when it comes to treatment plans. Triage or medical referral. So, for example, knowing when someone is a candidate for over-the-counter medication or treatment versus when they should be referred out to see a physician. Okay. Therapeutic goals or outcomes. So what are we trying to treat someone's blood pressure to? What is their cholesterol value that we're trying to obtain for that individual? What are their goals? Medication reconciliation. So looking at indications or therapeutic uses, identifying inappropriate indications, omissions, right? Making sure that safety stuff there is important. Dosing and dosing adjustments. So how long should someone be on this antibiotic? If their kidneys aren't functioning well, do we have to reduce the dose, right? Those safety pieces that are so integral into the safe and effective practice of a pharmacist. Drug route of administration, dosing forms, delivery systems, contraindications, precautions, allergies. So giving someone a medication that they're allergic to is dangerous. They want to make sure with the NAPLEX that you're able to identify those cross-reactivities with allergies, those conditions that are contraindicated with our common medications so that they can evaluate your safety to practice. Other things in Area 3 include adverse drug effects. So what are the most common side effects, but also rare but serious side effects? Drug interactions. So that can include the cytochrome P450, so kind of our pharmacokinetic drug interactions, absorption difficulties with co-administration of other medications, but also drug disease and drug-food interactions, right? So it's not just drug-drug. Therapeutic monitoring. So when do we check liver function tests? When do we check blood pressure? How often do we check these things? Kinetics and dynamics of the medications themselves. Evidence-based practice. So guideline stuff. Now, obviously, if there's a very recent change in guidelines, those won't be applicable. So that can get a little bit more difficult, but understanding how to practice evidence-based medicine. And then non-drug therapy. So self-care, first aid, supplements, complementary alternative medicine, medical equipment, lifestyle changes, things like DASH diet, sleep hygiene, all that kind of stuff goes down in this section. Area 4 is calculations. So calculations is one of the save or stink kind of areas, because if you are able to do calculations, that is going to carry a pretty good weight, 14% on the exam. Okay, and people who struggle with calculations often will have a hard time on the NAPLEX. So things that can be asked on in the calculation sections is, calculating ionization and osmolarity, looking at how much to dispense, right? So if you are dispensing a volume or a number of tablets, making sure that those are calculated appropriately, rates of administration over time, patient parameters, laboratory measurements, dose conversions, all of these things that require calculations to occur in order for you to practice safely are important, and oftentimes can be a challenge for students if they don't feel really confident with the math component. Other pieces in calculations, nutrition. So things like total parenteral nutrition, calculating kilocalories for, the various types of macronutrients, biostatistics. So at the basis, being able to calculate a number needed to treat and a number needed to harm, and how to round on those. Understanding what type 1 versus type 2 error is, those types of things. Pharmacokinetic parameters, so calculating a creatinine clearance and adjusting doses appropriately. So lots of things to take into consideration. There's potentially going to be questions on compounding of medications and how to calculate the appropriate amount of product to include in a compounded medication. Lots of calculations. Area 5 is dispensation. So compounding, dispensing, administering, and managing medications, more or less, right? So this is going to be a smaller proportion, so 11% of the exam, but that's going to include things that affect the pharmacokinetics of a product. So those physiochemical properties that will affect the stability, the absorption, etc. Hazardous and non-hazardous sterile compounding. So what are the techniques to compound products safely? We want to think about both sterile and non-sterile delivery systems, techniques for drug administration. So, do you aspirate an injection? Do you not aspirate this injection? Is there a specific way that someone should be taking or administering a medication? Appropriate handling, packaging, disposal of medication. So how do we manage those pieces of safe medication use? Area 6, which is 7%, is developing or managing practice or medication use systems to ensure safety and quality. So they do sound a little bit overlapped, but if you actually look, there are differences in these, right? These are a lot of the interprofessional aspect and the it kind of almost administrative aspect of pharmacy. So things like transitions of care, screening programs, stewardships, that could be antimicrobial stewardship, opioid stewardship, polypharmacy management, thinking about vulnerable populations, risk prevention programs, interdisciplinary practice and collaborative practice. So any of those pharmacy enhancements, informatics. So I don't want to say the science, but the practice of looking at delivery systems and things like that. So interesting section here, smaller section, but knowing those pieces of pharmacy as well. So now that we've kind of talked about the general areas that are within the blueprint, they kind of lack some specificity. They do that purposefully, I believe, because they're not going to tell you, oh, you have to know, all the aspects of antimicrobial stewardship or opioid stewardship, or you have to specifically know XYZ. It's knowing in general, and that allows for a lot of flexibility in the question types and the areas that they're going to ask. So once you take the exam, how do you get a score report? They don't give you singular scores anymore, so you don't get like 150 or whatever, right? It's now reported as pass or fail, but they will give you feedback and reflections on what your scoring looked like. So they'll level it like this, right? So level 4 exceeds, level 3 minimum. So 3 is where you are passing. Below that is going to be areas that you did not pass, okay? You do not get a numerical score. You get this overview of how you did. And what that can look like here is through your exam report. So your exam report will actually level you out in each of these competency areas. So as you can see, this level 2, and if we, can I go back? Boop. Yeah. So level 2 is below. So, oops. Oh, where'd you go? There we go. So level 2, if you're here, then you would be in trouble, right? But you'll get different scorings based on how well you performed in each of these domains, and it'll give you that type of information, okay? So once you get that scoring, what do? Well, hopefully you passed. If you didn't pass, you want to look at those areas that you performed more, with more difficulty to focus your efforts for your retake. But things to think about just in general as you prepare to take the NAPLEX. Top, honestly, 300. Knowing the brand and generic, because being bamboozled by a generic that you didn't recognize or a brand that you didn't recognize. That is the worst feeling. I had an experience similar to that when I took the NAPLEX, although this was several years ago, right? So in 2011, where I had a series of questions on a brand name of a drug and I wasn't certain what that brand name was. So I did my best to kind of guess what it was, but I was not confident. So being aware that that can happen if you're not really confident in knowing your brand and generics. Consider having an accountability group. So people who are also in the same boat, in the trenches with you, getting prepared to take the NAPLEX. Finding a really good structure, including a space that you can focus, a place that is comforting, that you can be calm and really spend that time, do that deep work to study, and doing it consistently. Don't sleep on calculations. If you are very, very proficient in calculations, that's going to save you so much consternation. If you don't feel confident, touch base with calculations frequently and consistently. Because if you do it right at the beginning, a month or so before you take the exam, that's something that if you don't practice it, is very quick to be lost, right? So making sure you can calculate day supply, unit conversions, creatinine clearance, ideal body weight, right? Knowing how to go from pounds to kilograms and vice versa, centimeters to inches, your TPN or total parenteral nutrition calculations. When you're taking the exam and any sort of preparatory test questions, read the item twice. I cannot stress this enough. As someone who will sometimes skim through and misread or skip a really important word in the item, it's so important. Read that question twice and try to think of the answer to that question before you even look at the options. So read the question. Okay, what do I think the answer to this question is? And then look at the options. Okay, really try to figure out what the question is asking before you start working through all that extra stuff. And sometimes that can mean looking at the test item, what it's asking before reading an entire really, really long case as well. That'll save you some time. Using those resources. So at our college, we use RX Prep, and it is your friend, right? So if you have a resource that is available to you, reflect on your practice questions, use recordings, use the resources that are offered to you, even if you feel fairly comfortable with what's going on, okay? If you are using something like RX Prep, a lot of times they will highlight things that they've determined to be useful or important. So things that are bolded or underlined, really trying to make sure that those really sink in and you remember those relationships. Understanding foundational concepts and trying to connect those things together. So a great example that I like to use is with beta blockers and with beta agonists, right? So if you remember beta receptors, so you have beta receptors in your heart, you have beta receptors in your lungs. If you have a beta blocker, it slows down your heart rate by blocking beta cells in your heart. Those are beta 1 cells. If you have a non-specific beta blocker, it can also block beta 2 cell or receptors in your lungs and can worsen asthma. Beta agonists like albuterol can increase heart rate because it's activating beta cells, but also can dilate the lungs because of beta 2 receptors. But if you didn't understand beta receptors very well, that's a lot harder. All of that just turns into memorization. Okay. So medications or situations that have opposing or complementary foundational information, cholinergics versus anticholinergics, beta, so many things, hypertensives, antihypertensives, really trying to work from that ground up, making sure that you understand the foundation can be really, really helpful in retaining information that you're studying. Do not cram. Break it up, pace yourself, and be introspective about what areas might be more difficult for you and give those more time, more space. Maybe you had a really robust rotation in infectious disease and you feel pretty comfortable with infectious disease. Maybe that's not your priority. You kind of, sprinkle it in here and there, but that you feel pretty rough on cardiology. Make that a bigger priority, right? Make that area of challenge a space you might spend some more time on, but certainly don't sleep on ID. Just don't spend as much time if you're comfortable. If you do fail, review that report, right? Think about what might have gone wrong. Did you have to rush at the end? Did you have a common area that might trip you up? So things that students often report are calculations, HIV, oncology, infectious disease. Those are common things that if you're not confident in can pose a challenge. And areas that the test will, test you on might focus heavily on one of these. You might get that test, blueprint that asks a lot of HIV questions. Balance that time, right? Don't focus on working a ton. Really take that time for yourself to streamline your calendar, to give that focus time to study. Check in on yourself. Make sure that you are feeling good. Mental and physical health can negatively impact your success. So making sure that you are taking care of yourself and rewarding yourself for your already hard work. Don't stress yourself out too much. Of course, for my students, if you do have any questions, really ask, right? That's what I'm here for. But questions, comment on anything, I can try to help answer those questions. And remember that every expert was once a beginner. So you can make it, you can do it. It's really important, right, that we take that time. I also have a sample calendar that I wanted to briefly share. So this is something that I find helpful when you're trying to prepare because there are so many different areas, right? So this offers a couple rest and catch-up days, right? But is essentially a 6-week study calendar that I would suggest people use, right? So as you can see, there's different, I'm going to zoom in just a little bit so that you can see things a little bit better. But like, for example, in your first week, you might be looking at congestive heart failure and other cardiology stuff, GI, sprinkling in those calculations all over the place, right? And maybe these are the areas like infectious disease that is a little bit harder for you, right? Hepatitis, these kinds of things. Hepatitis. Whoops. There we go. So this can be very customizable based on your perceived areas of needing a little bit more focus, right? So you might bold out different ones. You might not need as much in psychiatry, or you might not feel like you need as much in HIV. But having this space and checking off each of those days, reflecting on how you're doing, can be incredibly helpful just to keep you on track. And if for some reason maybe you're not feeling good one day or something happened, that's where these rest or catch-up days can be really, really helpful in giving you the opportunity to go, okay, when I went through genomics on Thursday, it was not clicking. So I'm going to spend a little bit of time on Sunday, the 9th, to really work on that, right? So this will give you an opportunity to keep yourself on track, because that can be incredibly difficult to do if you don't have a good structure, a good consistency with how you are practicing. So with that, I appreciate your time and your attention. I hope you learned something useful here. And it's never too early to start studying, to start focusing, and you can do it.